Our culture here makes it a great place to work. The patients make it a great place to work. So if you want to do pediatrics, this is a place to come. There's nothing we can't do here. The growth opportunities are endless here. For my units, we provide care to the PMU patients. It's the Pediatric Epilepsy Monitoring Unit. It's the only one in the state. It's the only seizure disorder program in the state, the only eating disorder program in the state. We're the only level 1 trauma center in the state. We're the only ones that do pediatrics for that as well. Cardiology, there's a lot of onlys here. You can do any disease process. You can do anything head to toe for pediatric patients here.
We take all surgeries, so that can be anything from an unperforated appy, so those kids go home the same day, and then we take anything from a bladder augmentation. We take spinal fusions, so those kids are here a lot longer. So there's a big mix. I always tell people we are surgical nurses, we're trauma nurses, we're ortho nurses, we do all of the things. So I never go a day without learning something. I never see the same thing every day, so it's not repetitive at all. I always tell, if I have a preceptee or a student, I tell them, I come to work every day and I learn something new, no matter what. Even if I have seen that surgery tons and tons of times, there's always something. Every patient is different. So I really feel that gives me the opportunity to expand my knowledge. I am constantly learning. We take all sorts of kids from all over.
So through orientation, that was a big help. I was assigned a preceptor from about July to October. That every shift I had another nurse following me around, helping me with everything I needed. And then after I was off orientation, there was still always a helping hand that was able to answer questions that I had. And then our managers also would touch base with us about every week, trying to see how we were going as new nurses and if we had any questions or if there were any resources they could help provide us with to make our transition a little bit easier, which was very helpful. Being a nurse at Oklahoma Children's Hospital has been a great experience for me. I am learning so much every day. There's opportunities to see new types of patients, to reach new families, just to have an impact on the children of Oklahoma, and I am very grateful to be able to serve our community.
I really think that it comes back to the teamwork here. So everyone that you talk to, that comes to our unit, that floats to us as a traveler here, they always come back to you guys are such a good team. Our floor can be really crazy. It's very high energy, and there are days that you can't do it all yourself. So I think that on the hard days, the people and the kids keep us coming back.